Good day, everyone. I'm Cheryl Di Maiyakan, a caregiver student from St. Augustine School of Nursing, Lipa City. And today, I'm going to perform oropharyngeal suctioning and nasopharyngeal suctioning. Suctioning is defined as the aspiration of secretion open through a rubber or polyethylene catheter connected to a suction machine. The purposes are to clean airway of secretion, to facilitate breathing, to obtain secretion for diagnostic purposes. For a newborn or infant, it is done starting on the mouth, then proceed to the nose. It is because if you will start from the nose, you will trigger the sneezing reflex and this will result to aspiration. Then for the adult suction, the mouth first, then proceed to the nose. This is done for aesthetic reason. In performing suctioning, we will be needing the following equipments: suction machine, suction tubing, suction catheter, gloves, oximeter, stethoscope, alcohol for hand hygiene, sterile water, basin, and a towel. To perform, first we must check for the doctor's written order for suctioning. This prevents potential errors for the patient. Checking identification ensures client safety to concept correct procedure for correct client. Next, perform hand hygiene to prevent transmission of microorganisms and prevent possible infections. Then, provide client's privacy and organize all needed materials. This is to check the quality of the equipment and to save the time as well. Identify the client and explain the procedure to the client. Explanation can reduce anxiety and encourage cooperation with the procedure. Good morning, ma'am. I'm Cheryl, your caregiver for today. May I know your name, ma'am?
May-an,
And when is your birthday?
September 30, 1975.
May I see your husband, ma'am? Okay, ma'am. Today, I will be performing oropharyngeal suctioning to clear airway of secretion. Will that be okay, ma'am?
Okay.
Apply a pulse oximeter to monitor the oxygen saturation level. Then help the patient into a semi-fowler position if conscious. Semi-fowler position helps prevent aspiration of secretion. If unconscious, in side-lying position towards you. It facilitates drainage of secretion by gravity and prevents aspiration. Assess for signs that the patient may require suctioning, such as restlessness, gargling, drooling, ineffective coughing, or gastric secretions. Place clean towel or drape her neck and chest, then put on gloves. Fill a cup or basin with about 100 milliliters sterile water or sterile saline. Connect one end of the tubing to the suction machine and turn on the suction, then connect the other of the tubing to the young catheter. Verify the suction mechanism if working by suctioning a small amount of sterile saline from the basin. If the client has an oxygen mask, remove it but keep it near her face. If she has a nasal cannula, leave it in place. Now, insert the catheter into the client mouth, moving along the gum line toward the pharynx. Apply suction and move the catheter around the mouth until the secretion has been cleared. If the patient has an oxygen mask, replace it. Now, suction water or normal saline through the catheter until the connecting tubing has been cleared by secretions with the suction turned off. Here's the tissue for you, ma'am. Assess her respiratory status and repeat the suction procedure if necessary. Ma'am, is your breathing a little bit better now? Your oxygen level coming up nicely. Then, remove the towel and place in the laundry if soiled. Store the catheter in a clean, dry place. Would you like, ma'am, to get reposition? Help the client in a comfortable position and perform mouth care as needed. Discard the remaining water, then remove the gloves and dispose them properly. Then, perform hand hygiene. Lastly, document the procedure, including how well the client tolerated the suctioning. Note the amount, consistency, color, and odor of secretions. Performing nasopharyngeal suctioning, make sure that the client has no contraindications to the procedure such as bleeding disorder and laryngospasm. In performing nasopharyngeal suctioning, we will need the following equipment: suction tubing, suctioning kit, soluble lubricant, alcohol for hand hygiene, sterile water, oximeter, and a towel, and suctioning machine. Next, perform hand hygiene to prevent transmission of microorganisms and prevent possible infections. Then, provide client's privacy and organize all needed materials. This is to check the quality of the equipment and to save the time as well. Introduce yourself to the client and verify the client. Good morning, ma'am. I'm Cheryl, your caregiver for today. May I know your name, ma'am?
Mahal.
And when is your birthday?
September 24, 1976.
And may I see your wristband, ma'am? Okay, ma'am. Today, I will be performing nasopharyngeal suctioning to clear the airway of secretion. To start, place a pulse oximeter on the patient's finger and leave the device in place. Help the patient into a semi-fowler position and put a mask if splashing is likely. Then place a towel in client's neck and chest to prevent contacts of secretion to the client. Prepare your equipment by connecting one end of the tubing to the suction machine. Turn the suction device on and set the pressure to the lowest level possible that will effectively clear secretion. After checking the pressure by blocking at the end of the tubing, place the open-ended tube near the patient within easy reach of your work area. Now, prepare the suction catheter by opening the suction kit or catheter using aseptic technique. Fill the tray compartment for about 100 milliliters of sterile normal saline solution or sterile water. Then, open the water-soluble lubricant and squeeze on the sterile open catheter package. Be careful not to touch the package. Depending on your agency policy, you'll now apply either a pair of sterile gloves or a sterile gloves on your dominant hand and a clean glove on your non-dominant hand. Use your dominant hand to pick up the suction catheter without touching any non-sterile surface, and use your non-dominant hand to pick up the connecting tube. Attach the catheter to the tubing. To make sure the equipment is working properly, suction a small amount of normal saline from the basin. Increase the patient's prescribed oxygen flow rate, instructing her to breathe slowly and deeply. Tightly coat 6 to 8 cm or 2.4 to 3.2 inches of the distal end of the catheter with a water-soluble lubricant. Ma'am, I'm going to go ahead and suction your nose into your lungs to help get out some of those secretions. Using your non-dominant hand, remove the oxygen delivery device and ask the patient to inhale deeply. Use your dominant thumb and forefinger to insert the catheter gently but quickly into one of her nares as she inhales. As you insert the catheter, do not cover the catheter bend. Follow the natural course of the nares. Orient the catheter downward slightly. Don't force it. If you feel resistance, probably you hit the carina. In that case, withdraw the catheter to 1 to 2 cm between 0.4 to 0.8 inches before applying suction. When you're performing nasopharyngeal suctioning, a good general rule is insert the catheter to roughly the same depth as the distance from the mouth or tip of the nose to the angle of the mandible. In adults, that's about 16 cm or 6.4 inches. In older children, it's 8 to 12 cm or 3.5 inches. Or in infant, it is 4 to 7.5 cm or 1.6 to 3 inches. In some instances, turning the patient's head can help you suction more effectively. Apply intermittent or continuous suction by placing your non-dominant hand over the bend of the catheter for 15 seconds or less. At the same time, slowly withdraw the catheter as you roll back and forth between your dominant thumb and forefinger. Then, encourage the patient to cough. Then, replace her oxygen device and instruct her to inhale deeply. Assess for the need to repeat this suctioning procedure but don't perform more than 2 passes. For alterations, cardiopulmonary status, when possible, adequate time, at least 1 minute between suctioning passes to allow ventilation and oxygenation. Rinse the catheter and connecting tubing by suctional normal saline until the catheter and tubing have been cleared of secretions. When you have finished suctioning, detach the catheter from the connecting tubing. Then, loop the catheter around the fingers of your dominant hand and pull your gloves off inside out around the coiled catheter to isolate the contaminants. Remove your other gloves and turn off the suction machine. Dispose of your supplies in the appropriate receptacles. If indicated, reset the patient's oxygen to its original level. Remove the towel and reposition the client to a comfortable position. Perform oral hygiene as necessary. Perform hand hygiene. Document the procedure including your pre- and post-suctioning assessment, the amount, consistency, odor and color of patient secretions, the use of the catheter you use, and the patient response to the care.